2020 was the year that reshaped the world with the outbreak of COVID-19, a pandemic no one expected or anticipated. Its rapid spread shook countries, affecting lives and ravaging economies. In February 2020, Nigeria recorded its first case with over 50,000 confirmed cases and 1,000 deaths within the first 6 months. And 15 months down the line, its effect still lingers with over 166,000 confirmed cases. Due to its emergency nature, Nigeria, like other African countries, initiated emergency interventions to strengthen a weak health infrastructure and to also cushion the virus effect on the economy. Donations, grants and relief materials poured in from both local and international bodies. Notable private coalitions like COVID and Victim Support Fund rose up to the occasion. As part of the response, the federal government rolled out 500 billion naira from the 2.3 trillion naira economic sustainability plan to cushion the effect of the pandemic. This includes the provision of 126 billion naira for the health system, 15 billion naira for MSME guaranteed offtake stimulation scheme, over 12 billion naira for mass rural electrification and solar power strategy, among others. While the government's expenditure has been huge, fully accounting for what has been spent has been far-fetched. The noticeable trend has been that most governments took advantage of the emergency situation to misappropriate emergency funds with zero accountability regarding expenditure on COVID-19 response, ignoring procurement procedures, and in some cases, outrightly diverting funds and materials into private pockets. The federal government, through the Ministry of Humanitarian Affairs, also embarked on providing palliative measures, including the conditional cash transfer, homegrown school feeding program, and the distribution of food items to all the affected states in Nigeria. However, lamentations have trailed the distribution of these palliatives by the supposed beneficiaries.
I didn't see anything, no, but I had it. They said, me, I don't see anything. Nothing. We don't see anything, no, me, I don't see.
We not receive anything. Common Edo, we not see.
The community I live in, the local government provides some palliative, although I was not beneficiary to it.
None of us was given cash. The only thing that was given was food. And the food is not even everybody. It was not even everybody. It was even very little.
Rí o, a kàn fẹ́ tí ń gbọ́ ni. Ọ̀nà pín ráìsì, wọ́n pín sẹ́mù, wọ́n pín òróró. Etí la kàn fi ń gbọ́. A rí nǹkan kan.
Kò síbi kankan tó ń pín kankan rárá. Wọn ò pín anything. Èyí tó ń gbé wá fún wọn láńlọ́ọ̀dù níbi Fàjọ́l Hotel bí báàgì ráìsì 4. Òun dídí gbogbo community bíi 8.
Remember, they brought some into the locality then, but what they brought was not even enough at all. Because if in a community of about 500 people, you are bringing a bag of rice for them to distribute.
This was further aggravated by the sudden discovery of several warehouses across the country with palliatives hoarded for political purposes rather than for its onward distribution to the most vulnerable citizens across the country. With the weak health infrastructure across the country, frontline workers were at greater risk of being exposed to the virus while caring for patients due to inadequate personal protective equipment. This led to the infection of no less than 800 frontline workers in the country, with some cases resulting in loss of life. Support from both the federal and state government was far in between for many, while some were fortunate to receive adequate care when they got infected.
But the government tried in responding with equipment. We had massive supply of face masks, sanitizers, ventilators to assist patients. But what we lacked was staff. We were still short of staff.
I think the strategy to put in place is to equip our medical facilities, be it the general hospitals, the health centers, the state hospitals, and so on, They should ensure they employ more health workers, ensure there are enough medical facilities, and ensure daily disease surveillance in all the nooks and crannies of the state.
I was one of the health workers going around to talk to people, relate with people, and talk about COVID. I think that is where I was infected. I was given the zinc, vitamin C, antibiotics. I was given chloroquine, just five different drugs.
CTAP, an initiative that seeks to promote accountability and transparency through the tracing of COVID-19 intervention funds across 7 African countries, Nigeria inclusive, is leading the advocacy for accountability from the government.
In the case of future occurrence, government should lay down good modalities in the sense of palliative, citizen inclusion, where community leaders, religious leaders, and maybe CDAs should be more involved so that there will be equal distribution of palliative.
While there are institutional systems of accountability, what is lacking has been the political will of government officials to adhere to these standards. This often manifests as lack of provision of data, lack of regular updates of information, lack of access or poor access to information, and lack of punitive measures for erring officials. During the CTAP event launch in Abuja, the Minister of State gave a detailed account of how the monies appropriated for COVID-19 was spent, but most of these expenditures cannot be independently verified.
So the government has been transparent to a particular extent. The amount of money allocated to that sector is public information. And as far as the presidency is concerned, there are certain milestones that it has reached in terms of creation of jobs and infrastructure provided from that money. However, there is uncertainty regarding whether or not those claims are indeed true, because there has been no independent verification made on these claims. Moreover, any serious analyst or interested citizen would like to see the performance of these sectors in the implementation reports, which are public documents that speak specifically to the government's application of its money.
While the country is lucky not to witness the devastating effect of COVID-19, as some countries across Europe, America, and Asia did, the critical issues of strengthening our health infrastructure and accounting for all funds spent and all contracts awarded cannot be swept under the carpet. The government must provide independently verified data on all COVID-19 spending and also punish erring officials who have engaged in corrupt practices. The COVID-19 Transparency and Accountability Project, CTAP, is currently running in 6 other African countries, including Ghana, Sierra Leone, Liberia, Malawi, Kenya, and Cameroon, tracking all COVID-19 funds and demanding accountability.